This morning you heard a little bit about how different ways to make outcomes frameworks work more effectively to evidence youth work. I'm going to be talking about a different approach, but I think actually, having read Bethia's paper, using quite a lot of the same thinking, but kind of from a different way around. So the title's Kittens Are Evil because it's about saying things that are unsayable. So committing heresies in public policy. So my first aim is to show you that I'm not some weird cat hater and that you can take the RSPCA off your speed dials. But I just thought I'd start by saying what the beginnings of this kind of heresy that outcomes are bad were for me. Because in my day job, I'm chief executive of a voluntary sector organisation that works with some of the most disadvantaged people in the North East. And like you, I was and have been being bombarded with this stuff about outcomes, essentially told that they're the only game in town. But something never felt right to me about that outcomes discourse. It just didn't feel truthful. And this was reinforced for me because in private, when I talked to people about outcomes and outcomes frameworks, people said that they didn't really believe in measuring them, they're just doing them to keep funders happy. And these were people whose job it is to work with some of the most disadvantaged people who cared passionately about the impact that their work made in the lives of people. And all these things are exactly what outcomes and outcomes frameworks are supposed to be about. And yet these people didn't believe in at least in private. But they were afraid to say so in public. This was illustrated for me a couple of years ago at a State of the Voluntary Sector conference in Newcastle. And like you, we were having roundtable discussions about different voluntary sector issues, and then feedback from each table by someone getting up on stage and saying what we've been talking about. And I was asked to give feedback from our table, so I got up on the stage and said, outcomes, they're a lie, aren't they? Gasps and silence, some kind of vigorous nodding. And then the chair of the conference came to usher me off stage. Felt the need to turn to the civil servant who was up from London and say, well, actually, I'm not sure that would be the view that we would want to put out there. The voluntary sector is wholeheartedly engaged with outcomes, and we would very much want to be part of it. And what? That's not what we were just talking about. So how do we get to a position like that? How do we get to a situation where people in private say that outcome measurement frameworks are nonsense, but in public we're terrified to say what we think? And this whole discourse was beautifully summed up for me by in conversation with a colleague, and she was saying that questioning outcomes is like saying that kittens are evil. So if you're going to call the RSPCA, it's a woman called Charlotte Pell that you want. But that experience of that conference was a real eye-opener for me. Made me want to ask questions about outcomes frameworks. So if everyone on the ground thought they were awful, why were they flavour of the month at policy level? Maybe we want to do some proper digging about this kind of stuff. And I was lucky enough to be able to start asking questions. So what's the theory that underpins outcomes thinking? Is it good theory badly applied, or is it flawed theory from the outset? And what impact does adopting these outcomes measurement frameworks have on the services that are offered to people? What's the evidence around this kind of stuff? And I was lucky enough to be able to be offered a visiting fellow role at Newcastle University Business School that allowed me to ask these kind of questions. So firstly, what's the theory that underpins outcomes thinking? And I think it's really important for us as kind of practitioners to be able to have access to these kind of conversations, because normally we only get to see this kind of stuff when it's packaged up for us in shiny toolkits, or in kind of presentations where people are telling you this is how you must do it. But actually it's never like that. There are always arguments about how to produce things, and these concepts are messy and contested. So I wanted to kind of get into some of that and look at the messiness and contestedness of it and be able to share that with people. And I also wanted to look at this, the evidence, to see what happened when people had implemented outcomes frameworks as performance management tools. And it turns out there's been a shed load of research done in this kind of area. Really loads of studies done, but we never really get to see that as practitioners because it's hidden away in academic journals, and who's got time to read academic journals? So, what I want to present to you today is the result of me looking at those academic journals, bringing together the different studies that other people have done, looking at the theoretical framework, looking at the evidence around implementing outcomes frameworks. And this presentation is based on a paper that's going to be published in the journal Public Money and Management next year. But before we get into the meat of the presentation, I need to say something about language, because you can't talk about outcomes frameworks without really trying to be more precise about language. So I'll use various bits of shorthand in this presentation, like outcomes thinking and outcomes frameworks. But what I'm talking about in all of these cases is a movement that was started in the early 1990s called outcomes-based evaluation. And it was pioneered by a person called Robert Shallock, amongst other people. And it basically proposed measuring the effectiveness of organisations, programmes or projects by looking at the results that they achieve, the impact that the work makes in people's lives. And it started, therefore, in the world of evaluation and then moved into the world of public management. Here it became outcomes-based accountability, or results-based accountability if you're in the States, results-based management, and most recently, payment by results, which, as David Cameron helpfully said yesterday, we should all be doing now on. But essentially, all of those frameworks have the same root: the idea that you should measure the performance of people and organisations who deliver social policy interventions by looking at the outcomes they produce. That is, by the impact they make in the world. So that's what I'm talking about. So what did my research find? Firstly, that outcomes frameworks don't measure impact in people's lives. Secondly, that outcomes aren't delivered by an organisation. Thirdly, that outcomes thinking distorts organisations' priorities. And fourthly, that outcomes frameworks undermine good frontline practice. And I'm going to go through each of these ideas in turn. So first one, outcomes don't measure impact. Hang on, what? What a ridiculous thing to say. Understanding impact in people's lives is what outcomes are all about, what they're for. Look, it's what people say about outcomes. Look. This quote comes from the United Way in America, which is their equivalent of the Community Foundation or kind of big lottery. But I could have taken this quote from one of 100 different publications. Why do you measure outcomes? To see if programs really make a difference in the lives of people. So okay, let's look at how you actually measure outcomes. And what I did, I wanted to turn to the original text, like I was saying, to really uncover some of this. And so I turned to the person who wrote the book, literally, on how to do outcomes research, Robert Shallock. So let's say you want to know whether an employment programme has resulted in more jobs for a kind of particular target population. What does he say about how you need to do that? He says, first of all, you need to identify a delivery group of people, so people who had the intervention, and then a control group, so a set of people with the same characteristics but who didn't get the intervention. Or at very least matched pairs of individuals, one who gets the intervention and one doesn't. Otherwise, how do you know it's the intervention that has been causing the results that you see? And what are the things you need to control for? Well, he says he suggests that you should control for age and gender and functional level and educational status and intellectual level and risk level and diagnosis and prognosis, or the individual's time within the programme. And then you need to do very specific types of research with those people who've been controlled into those groups. He says you need to do both in-depth qualitative studies with people, so lots and lots of qualitative research, interviews, and you need to do large-scale quantitative research using those control groups, surveys, questionnaires, that kind of stuff. And he says that you should have the participants themselves, the service users, design those questionnaires, so that the questions you ask are kind of meaningful to them and you're getting responses that mean something to them. And guess what Shallock considers to be the very minimum level of time that you need to do longitudinal follow-up studies in order to get a meaningful result? 2 years. 2 years worth of follow-up interviews with people after they've finished on your programme in order to get them. That's the minimum he suggests doing. He refers to that as a short time of post-programme evaluation. So, first question. Hands up who regularly does their outcomes assessments based on 2-year longitudinal studies of matched control groups with in-depth narrative interviews and with questionnaires that have been designed by service users. One!
Am I joking?
Exactly. Because doing that kind of level of research would be ridiculous. You'd spend as much, if not more, on monitoring and evaluating your programmes as you would on delivering them. But if you're not doing that, you're not collecting outcomes data. You're not actually looking at the impact that a programme has made in someone's life. And we'll see why that could be problematic shortly. But all this is pretty obvious, right? Surely if that was all there was to outcomes, then it would have been rejected as being too impractical a long time ago. So why the popularity of these outcomes frameworks? Well, turns out that outcome measurement has an evil twin, dark side. So all that stuff about engaging service users in the design of outcomes frameworks, really spending time with them to understand the impact of the intervention as it's felt in their lives, that's called the quality dimension of outcomes. And it looks specifically at the quality of service provision. See? Happy smiley face. But there's another dimension to outcomes framework. It's called the accountability dimension. And that's about reporting to funders or senior managers, stuff like that. That's not so much interested in what the intervention was actually like in someone's life. It wants to know whether you've met your targets or not. Whether you've performed better or worse at meeting your targets than the person, team or organisation next door to you. And what are the characteristics of kind of reporting for this accountability strand of outcomes measurement? Well, they say you should produce efficient, comparable data that could be put into report card format, data that can be shown on graphs and charts to senior managers and funders. Keep it simple. That's the message from the accountability. It must be efficient to collect this data. So, has the person got a job or not? Have they reoffended or not? It would be good, simple accountability outcomes. Now, hands up who's had to do that kind of outcome reporting? A lot more people. And this is what I think happens then with outcomes-based accountability. It's sold to us on the basis that it's about improving impacts of the interventions that we make in people's lives. It's about actually understanding the change that you make and improving the lives of the people we work with. Who could possibly argue with that? So it's sold to us on the quality dimension. That's the picture that's on the outside of the box. But when we get home and we open the box, we find what's inside is the accountability dimension. So all that stuff about genuinely understanding impacts on the lives of people, that's gone. Turns out that that's actually far too difficult. 2 years of post-program follow-up interviews, are you kidding me? We're going to measure what's measurable, what we can realistically and afford to measure. So we buy the lovely quality dimension, and we get its evil twin, accountability. Felt to me a bit like kind of buying a ready meal from the supermarket. Look at the picture on the box. Fields, countryside, pretty, wholesome. But then when you get home and get it open, tasty. So we end up measuring what's possible and calling those outcomes, while pretending what we're doing is measuring impact in people's lives. So let's think about how that might work in practice. Let's consider a potential example of someone that many of you could be working with, or maybe the family of many of you could be working with. It's a person with mild to medium mental health problems, caring responsibilities, so they could be caring for children, or they could have dependent elders. They've had problems with substance misuse, but they're in recovery now. And they're on an employability program, and the outcome target for them is to get them back into work. And lo and behold, they get a job. Brilliant. Accountability framework says tick, outcome achieved, job done. But what's the impact in their lives? How has the job impacted on their mental health? Are they getting positive benefits from feeling useful and associating with others, or is the stress of the role damaging them? How's the job impacting on their relationship with their dependent family? Is the time spent at work preventing them from playing an effective parenting role, or is it providing a positive role model for the family? If they're supporting a dependent parent, how has the loss of that caring time impacted on that parent's independence? Has getting that job made that family better off or not? Are the wages sufficient to offset benefit loss, or are they trapped in a cycle of kind of low skill, easily sacked work that sees people on and off benefits for years? What's the impact on that person's neighbourhood? Were they volunteering? Are they still doing it? And until you know the answers to those questions, you don't know the effect of that intervention on that person's life. Further, you don't even know whether it's saving the state any money or not, because you don't know whether the reduction in out-of-work benefits is being offset by increased use of emergency mental health services, or requiring extra emergency care for the dependent relative. So in order to say that you're understanding outcomes, and that you're using their knowledge of outcomes to inform service delivery, that's the kind of stuff you need to know. But no one does that in real life, because it's too difficult. And I think, for me, there was a key point about all this, that our desire for outcome information outstrips our ability to provide it. So we all want to know what the impact is, but that's just wanting to know it doesn't mean that we can. And there's a real kind of divide. Information about outcomes can either be simple, comparable, and efficient to collect, or it can be a meaningful picture of how that outcome is felt in that person's life. It can't be both of those things. So that's my first point. That outcome frameworks aren't actually measuring impact in people's lives. What else did I uncover when I started digging into this theory? Secondly, that outcomes aren't delivered by an organisation. So let's start by asking a couple of questions. What is an outcome, and how is an outcome made? Let's say, for example, that the outcome is preventing reoffending. So we've had people who've offended previously, and the outcome we want to achieve is them not offending anymore. Let's look at some of the factors that are cited as influencing whether someone who has previously been an offender reoffends. So that could be their employment and whether legal income is available to them, their family circumstance, the availability of housing in places where they generate positive peer networks, the relationships that they're in, their individual disposition, whether there's criminality in their peer network or family network, substance misuse. And each one of those factors is itself dependent on a complex interaction with further factors. So, if we think about that then, an outcome is made as a result of interactions of an enormously complex range of factors. It's a state of affairs in the world. It's a state of being. And if you try to map the interaction of all those factors that had led to the production of that outcome, it might look a bit like that. Except that it doesn't. Not if you're using particular types of outcomes-based frameworks. So that's it. They say, use this kind of mechanism. This is a program logic model. And it's the recommended way of conceptualizing the way in which outcomes are created. So you'll see here, it's a completely linear model. Moves from inputs on the left through to outputs to outcomes. What it's saying is find a problem, do an intervention, problem solved. So who here works with people with complex needs? People with a kind of complex problems in their lives? Show of hands, please. About half of you. So, you folks, can I ask you, what do you think the most accurate representation of the journeys that the people you work with take in order to get to an outcome? Which best models the interaction of factors with the intervention that you're providing? Is it that one? Show of hands? Or is it this one? Not so many people. So if everyone knows that this is a poor way to conceptualise the change that's being sought, why would we use such a model? And the answer is that outcomes need to be attributed to a particular person, team, organisation or programme. You have to be able to say who caused what. Otherwise, the accountability dimension of outcomes just doesn't function. There's no point. And in order to say who caused what, you need to simplify. You need to pretend the world looks like that. Because how are you going to attribute causality if the world looks like that? Okay, what's the impact then of this simplification? Let's look at the model again. It turns everything that isn't project delivery into a big dark lump called environmental context. And that environment has the potential to completely undo efforts to evaluate the effectiveness of that programme by means of looking at the outcomes that have been produced. So let's look at another kind of hypothetical what-if case study. So imagine an employability support programme for a group of people who are currently extremely marginalised. So that could be homeless people, those with enduring substance misuse problems, or mental health problems, or any kind of combination of that kind of stuff. Imagine the most perfect version of that employability programme that's possible to design. So we'd probably invest time building meaningful relationships with participants. It would offer support and activities which transform participants' sense of themselves, what's possible for them. It would help participants to build key employability skills related to the local labour market. It would help them with interviews and with placements in local firms. It would provide them with in-work support. That sounds like a pretty decent employability support program, doesn't it? Now imagine that 10 months into the the first cohort's journey through that programme, the local employment market collapses. The major employer in the area shuts its factory, flooding the local labour market with highly skilled, experienced people. The knock-on effects are felt throughout that firm's supply chain, more unemployed people, and the retail businesses supported by those it used to employ, more unemployed people. It's now impossible for an outcomes model to make sensible judgments about the effectiveness of that employability program. So it'll be asking, do those people have jobs? No, they don't. What does that tell you about the program or the organisation that was delivering? The organisational team that was delivering that program. Were they doing a good job? Were they hopeless? The program might have been being delivered brilliantly, might have been awful, but an outcomes approach can't distinguish between those two. It doesn't lead to learning for the organisation, doesn't lead to learning for the commissioners. Was that the right program delivered by the right organisation? Who knows? Impossible to tell, because the environmental context has just swept away any results that you might be looking at. What else gets missed if you use this kind of theoretical construct to model how outcomes are created? I think the people themselves get missed. Because what's the role for co-production in this kind of program logic model? How do you talk about people's role in creating their own change if you're looking at inputs to outputs to long-term outcomes? Where do you think about people's role? Well, you can shoehorn them into program inputs, maybe? But then how do you think about their growth and change during the program? You could say that they're part of the environmental context for the program, but really, is that how you want to think and reflect on people's role in creating their own change? The point is that this whole way of conceptualising social change is based on the idea that outcomes can be delivered by an organisational programme. Its whole purpose is accountability. It needs to find the person, team or organisation that's responsible for making something happen, and it struggles to think about anything that muddies that particular picture. And here we get to a core theoretical problem, because outcomes are the result of complex interactions. They're not delivered by organisations. They're created by an interaction of complex range of factors, some of which the organisation can control, some of which that organisation can influence, but many of which they can't control or influence. And so, as John Main identifies in his study of organisations who've attempted to manage the results in this way, outcomes are by definition results over which organisations do not have complete control. So, quick summary, those are the theoretical problems. What happens when you dig into the theory that underpins outcomes frameworks? You find two things. Outcomes don't actually measure impact in people's lives. They're sold to us on this basis, but as soon as you look at what's involved in genuinely measuring impact, people realise that that's far too complex and difficult to do, so people end up measuring what can be measured instead. And then there's this weird process of active forgetting that goes on. People choose to forget that there's a difference between what they can measure and what's actually going on in the world, and they treat what they can measure as if it actually represented impact in people's lives. And secondly, outcomes aren't delivered by an organisation, they're states of being, they're subject to enormous complexity, and the only way to ascribe outcomes to organisations is to pretend that the world is simpler than it is. And the interaction between these two problems is a key point, I think, for helping us realise that the problem is a theoretical problem for outcomes. It's a problem with a theory of outcomes rather than it just being about its implementation. Because if you try and resolve one of these problems, you automatically make the other one worse. So let's say that you're trying to address the first problem. You genuinely want to understand impact in people's lives. So you put armies of researchers to work interviewing participants to understand the impact of change in their lives. You do this over 2-3 years. You do your matched control groups, some with people who got the intervention, some people who didn't. The more information you get, the more complex the picture becomes. As time goes on, any change that your researchers are recording becomes more and more dependent on factors outside the control of the organisation who delivered the intervention. The more you know about an outcome in someone's life, the less you can say it was caused by the intervention you're looking at. And if you try and solve the other problem, if you try and narrow the focus of research into outcomes down to factors that are definitely attributable to a particular organisational programme, then you can't understand what that outcome actually looks like to the person. So for those of you with a scientific leaning, perhaps this is social policy's own version of the uncertainty principle. You can either genuinely understand change, or you can attribute it, but you can't do both. So, at this point, you might reasonably ask a question. If there are such problems with the theory, why haven't they shown up in evidence about when people try and implement this stuff? After all, we've been trying to implement these outcomes frameworks for about 20 years now. Well, it turns out there is lots and lots of evidence. Many studies have been done. This one was conducted by someone called Bert Perrin, who's another pioneer of outcomes approaches in public services. And he undertook a study into the impacts of numerous results-based management programs in Canada and the USA. I'm going to quote from him now. He said he found that outcomes frameworks create goal displacement, which leads to an emphasis on the wrong activities and encourages creaming and other ways of making the numbers without improving actual outcomes. As a result, these frameworks, frequently distort the direction of programs, diverting attention away from rather than towards what the program should be doing. Van Thiel and Lowe, in their study in 2002, reported similar findings from their meta-study of implementing outcomes-based performance management processes in Europe. They found creaming, which we often call cherry-picking, so helping those who are easiest to help and ignoring the most difficult, because those difficult people won't help you achieve your targets. Bevan and Hood's study of the NHS is particularly instructive for understanding the kind of game that goes on when people get outcomes targets that they're measured on. For example, they looked at what happens when accident and emergency departments get set a 4-hour waiting time, admission time for patients. And they said, what happens is that managers at hospitals cancel other types of operations and refocus staff to A&E during those inspection times. They found managers reclassifying trolleys as beds. So, if you're going to hit a admissions target, if you can't find a bed for someone, what else can we call a bed? Why don't we that bed? And they found that managers were making patients wait in ambulances outside the hospital until managers were sure that they could be seen in A&E within the 4-hour target, because the clock doesn't start ticking until they walk through the doors. And these are funny until you see the corresponding reports that patients died whilst waiting in those ambulances. And so Bevan and Hood's conclusion was that target-based performance always creates gain. Always. That's quite a strong word to use. And these are just the legal gaming things that occur when outcomes-based performance management is used. By far the simplest is a good old-fashioned making the figures up. So recent prosecutions of staff on A4E's employment programs are just the latest in a very long line of 1, 2, miss a few, 99, 100 at school of outcome measurement. And the studies I've been looking at are just the tip of the iceberg. I could have quoted from 10, 15 different studies. The evidence that outcomes-based performance management distorts organisational priorities is everywhere. So it's worth asking again, if all this is well known, why do people persist in using outcomes frameworks? And the problem seems to be that the people who've built this evidence treat those problems with using outcomes as technical problems which can be overcome, rather than seeing it as evidence of a flawed framework. So for example, Perrin, who found goal displacement, creaming, making the numbers. He doesn't recommend ditching outcomes frameworks for performance management. He says we just need to find the right measures. And then we should change our measuring systems every year so that managers don't learn what they're being measured on. Hang on, what? Changing the measures every year doesn't make any sense. How are you going to create comparable year-on-year information if you change the measures every year? And so you finally find something that does work half decently as a proxy measure, as a representation of reality. You need to change it just because people learn how to work with it effectively. It's insane. So, we know that it's not a technical issue about measurement. We know that there's no such thing as the right measure because outcomes don't actually measure impacts because that's too much work. And the more you measure, the worse the situation gets. Because it turns out those outcomes aren't simply created by programs or organisations, they're the result of complex interactions. So, let's have a quick look at what a leader does when confronted by outcomes-based performance management. Let's say that they're being confronted by payment by results. Let's look at the impact of the outcomes data on a manager's plan, do, check, act cycle. So, most of you will be familiar with these. This is how the recommended way to plan and implement a program and kind of review what's going on. So, what do I know as a manager in this situation? Well, I know that external factors, things over which I have no control, are going to strongly influence the results of outcomes measurement, so the outcomes data that's being fed in at the bottom. So essentially what that's doing is that's feeding outcomes data into my plan, do, check, act cycle that's essentially random noise. That's no good. If we don't produce the right outcomes data, then none of us is going to get paid. Paid by results, remember? So what can I do as a manager in that situation? Well, I ask myself, what is my performance actually being measured on? And the answer is production of appropriate data. So how do I produce this data? Well, I ask myself, who are the clients that are going to give me this data? Creaming or cherry picking? How can I target my resources towards those clients to produce the relevant data, teaching to the test or redirecting other doctors into A&E? What other ways can I produce this data? Can I reclassify? Do I just have to make things up? And if you look at the evidence of what happens when people do these outcomes-based approaches, the cherry picking, the teaching to the test, the reclassifying, that seems like a pretty plausible scenario for what people have been made to do. And within the literature on outcomes, they call this unintended consequences of outcomes-based frameworks. And I think that language is a bit problematic. Makes it sound like, oh my word, how could that possibly have happened? It doesn't matter, that's not what we intended to happen. Okay, let's look at this business of intention and what the context that's been created for all of us when commissioners use these kind of frameworks for commissioning outcomes. Well, firstly, commissioners make organisations promise to produce certain numbers of outcomes, because if you don't promise to deliver outcome targets, you know that someone else who's contracting for the work will do. So to win contracts, people are made to promise certain outcome targets. And then commissioners tell them that they have to produce data on outcomes, otherwise they won't get paid. And essentially what this is doing, I think, is to make commissioners are making people accountable for things that they can't possibly be held accountable for. So commissioners don't act surprised when people then use their creativity to produce the data that you're asking for. So I think this key point from this is that when commissioners use these outcome frameworks on which to commission activity and measure performance, and particularly if that's linked to payment, it's they who are responsible for producing this gaming behaviour. It's not bad apples in organisations, it's not people seeking to undermine the system. That's the system that is being constructed when commissioners use these kind of outcomes frameworks. So there may be unintended consequences, but they're perfectly predictable consequences, because we know, because this study after study shows this stuff. It's not good enough to say that the results weren't intended when you know that that's what's going to happen. So, to review, we've seen the evidence on implementing outcomes-based performance management distorts organisational goals. It encourages gaming, encourages creaming off those who are easiest to help, encourages teaching to the test, and reclassifying or simply making things up. Fortunately, this has been viewed as a technical challenge so far, something, if we change the measurement, we can make this work. But I think it's better to view it as evidence of what happens when you try to implement flawed theory. So, we've looked at the distorting impact of these frameworks on organisational priorities. Let's now look at the impact on frontline practice. There's fewer studies in this area. It's quite a new area of research, but there's a couple of pieces of research that show clear alignment with the findings on organisations. So, academic in Australia called Lynn Keevers has been the first person to study what's the impact of adopting an outcomes-based accountability framework on frontline workers within a delivery organisation. And she looked at a youth homelessness organisation in Australia before and after they had taken this OBA framework on board. Her key finding was that the shift to this outcomes-based system changed the way in which frontline staff and participants related to one another. In particular, she said it undermined the relationship-building elements of their work. So, I'll quote again. She says, it makes it more difficult to engage with and build relationships with homeless and at-risk young people. She says it has significant impacts on the daily practice of workers. She says it reduces the time available to create a sense of belonging. She says it reduces the time to develop young people's skills. Another important study in this area is Hilary Cotton, in her book, Relational Welfare. What she did was she undertook a time analysis of what social workers spend their time doing. And she found that 86% of social workers' time, I think this is in Reading, is system-driven. It's about filling in forms for accountability and discussing those with colleagues. 86% of a social worker's time. Leave 14%, for those of you mathematically minded, that's spent face-to-face with clients. But she says that 14% of time that's spent face-to-face still isn't developmental. Again, let me quote. The dialogue between Ryan and Tom, social worker, client, is dictated by the forms and their need for data and information. This squeezes out any possibility of the sort of conversation that might be needed to develop a supportive relationship as a first step in fostering change. So if you look at, kind of bring these two studies together, what's happening? I think it's a reversal of the relationship between worker and the person that they're working with. Changes from a situation in which the worker is saying, how can I help you achieve your goals, to a situation in which the worker is saying, how can you help me achieve my targets? The client actually becomes a data production mechanism for the worker. So, summary. If you dig into the theoretical framework, you find that outcomes don't measure impact and that outcomes aren't delivered by an organisational programme. And you find evidence for these as theoretical flaws in the study which have looked at the impact of adopting these kind of frameworks on organisations who deliver this work. And those studies find that outcome frameworks distort organisational priorities and they undermine good frontline practice. And I think the key to making change is to not to try to fix this system. It's conceptually flawed. It can't be fixed. The key to ask is, what's the next stage in our evolution about our thinking about creating effective social policy interventions? So, if not outcomes, then what? Now, I don't have any answers to that. And that's partly what we've been talking about all day. But it feels like it would be a cop-out for me not to share some initial thoughts that have arisen for me as a result of this kind of research. First one is that bottom-up is key. If you're going to look at impact, you need to understand the impact where it's felt by those people who experience it in all of its complexity. Secondly, the systems thinking is helpful because it encourages people to look at the complex relationships between different elements of a system rather than focusing on isolated features. And so it therefore escapes the linearity of those program logic models. Problem, solution, solved. And thirdly, I think we can ground this theory in social science better. Because it seems part of outcomes theory's problem is that it's not rooted in the understanding of how human behaviour in society works. And this seems odd when we know so much about how human behaviour in society works. So we know, firstly, that human behaviour is contingent on social context, the constraints and enablements of the circumstances we find ourselves in. And secondly, we know that our human behaviour depends on our agency, our ability to make choices about what we want to achieve and how to respond to and change the constraints and the enablements of the context we find ourselves in. So if we want to understand how to create positive social change, we can ask those two questions. Firstly, how will an intervention create a change in the social context of the target population? So if it's an employment programme, is it going to create more jobs? Secondly, how will the intervention create a change in the way people view their circumstances? So will it affect people's decisions about what's possible for them? Those are just some very initial thoughts. Really looking forward to hearing yours. And I hope that this has been interesting in some way. And that, like me, if you've always felt that something wasn't quite right about outcomes approaches, you feel empowered to say so in public. Go on, be that heretic. Thank you very much.